there, this is Taylor with West Physiotherapy, and I help women get back on the trail. And this is video number 1 of a 3-part series in honor of back to school. We're going to do some learning about hip pain and tightness. I asked you guys what do you want to hear most about, what keeps you from getting on the trail the most, and the response I get a lot is hip pain, hip tightness. So in this video, going to take about 6 or 7 minutes to go over a very common postural component that I see contributing to hip problems, especially in women. Number 2 is 2 of the muscle or body parts that tend to contribute to this postural issue. And number 3 is how to mobilize those 2 areas. So let's get started. This is obviously intended for educational purposes. I don't know your specific situation, and so these may not be the best things for you to do, but they're just some things to think about and potentially try if you felt comfortable with them. So, postural issue that contributes to hip pain and tightness, especially in women, especially in active women, hikers, runners, and also people who end up having to sit a lot, is that what I see is they're having trouble getting the weight from the top half of the body and the leg to transfer, okay? And so the reason this happens is the position of the hip is sometimes not aligned well. What we'd like is when you get on that leg for it to be straight line down. But what happens to us? We start to tip here a little bit. So we have some tightness in the low back, some tightness in through the front, okay? And some bulging here. And the reason this can happen, or 2 things that can partially contribute to this, are structures in the front. So this abdominal area, we have muscular tissue, the psoas and iliacus. These are muscles that attach to the hip that start up in the belly and pelvic region. Also, if you've got the bowels and the guts in here, so if you've got issues with constipation, anything in the front can be affecting this low back position, and this low back and pelvic position affects the ability of the hip to work when you're standing on it. So scar tissue, C-section scar, appendicitis, even gallbladder, these are all things that can contribute to this kind of getting pulled forward position. And the other area is down in the muscles of the thigh, and I feel like it's an area that often gets overlooked, and it's these adductors. We spend a lot of time thinking about quads, hamstrings, glutes, how do we strengthen them, how do we stretch them, but this is a large muscle bulk. It often gets overlooked, and it attaches to the femur, a little bit across the knee, and then it comes up and attaches right into the pubic bone, right in here. And so this is a strong pull on your pelvis that can pull it forward, it can kind of pull it sideways, and really get you into a not great hip position that then can lead to different kinds of pain, this kind of side burning pain or trochanteritis or glute problems, impingement in the front. So this kind of position can contribute to any of those things. Let's start with one possibility for kind of loosening up the abdominal area, and it's with just this little kind of like a dollar store squishy ball. It's inflatable and it's not very hard. I'm also not worried that it's going to pop or anything. I gave some of these to the women who came to my walk and talk the other week, and it was really cute. They were all walking around afterwards with their little tummy mobilization ball. So these are easy to find and not a lot of dollars to invest in. So I'm going to show you this by laying on your tummy. You could do some things laying on your back if you don't feel comfortable getting into this position, but I kind of like this one the best if you're able to do it. So for me personally, I know that I have some scar tissue restrictions kind of low down near the pelvis, so I like to take the ball and lay on it a little closer down in that area. But you can also roll it kind of over towards that front hip bone and see if you can let it sink in just inside that hip bone. There you'd be getting into more like iliacus and a little bit of either ascending or descending colon, depending on which side you're on. You can bring it a little closer to midline, maybe not right in midline because you don't want to be squashing the aorta or vena cava, and you can roll into a different position so it's hitting a different spot. You might be able to get down to some of the fibers of psoas. And when I go a little higher, I like to lay down. You could do the same thing if you feel comfortable. And then you can also play with the position of your legs. So you can do a little like rolling inside out here. And you're just changing the angle of things and kind of encouraging all that soft tissue. There's omentum, all kinds of things, just to slide and glide and kind of release. So you're not looking for pain or discomfort. You're just looking for areas that maybe feel like they have a little more resistance, and you're going to try to get those to loosen up just a little bit. Okay? And one thing you could do afterwards to see if you feel a little better is you could stretch backwards and see if your abdomen feels more mobile, or you could kind of check on your ability to sort of posteriorly tilt or get that low back to flatten onto the floor. Okay, so that's tummy, abdomen, mobilization. Let's move on to the adductors, the inner thigh. They love to be mobilized. Not really. Okay, what I like to use for this one the most is this foam roll. This is, you can find these on Amazon or a lot of sporting goods stores for about 20 bucks. And I like the density of the white foam. It's not as hard as the black. The black foam is so hard, it's really uncomfortable to do very much rolling or mobilization on. But it's also firm enough to really get into some trigger points and maybe make a difference. Because you want to make a difference if you're going to bother to get down on the floor and do it. All right, adductors. They're running on the inside of the leg, right up from the groin all the way down to the knee and a little bit across for some of them. So I bring the leg up to the side here and then kind of roll onto those muscles. And you're looking for, you're looking for where it starts to feel a little tighter. It might feel a little more tender. Don't hurt yourself. Don't make it hurt. Don't try to bruise anything. Okay. For me, it's like I almost have this little lump that I'm rolling over. So I'm going to stop there. Now, this is a big wad of muscle. So you might need to play with the angle of your leg. You might need to roll it up a little bit higher. You might need to bring it down a little lower. You might need to go way over and try to get all the way up to the insertion at the groin. Also, if you find a tight spot, like I did right there, then you can kind of rotate. That's quite intense. The foot up and down and really try to get into that spot. You can also bend and straighten. So using some active movement in addition to just the passive rolling with these exercises or mobility kind of techniques can really help go a long way towards kind of changing the matrix of all the soft tissue and fascia and even the tensile structures. Okay, so that's the adductors. I hope that was useful. If you have any questions, let me know below. I'll be doing 2 more of these over the next couple weeks, Wednesdays at noon, so you can just comment hip. I'll tag you so you don't miss them if you would like that. And otherwise, thanks for watching. Hey, Solstice Pelvic Wellness. I miss you too. Anybody else out here? All right, good to see you guys. Thanks so much. Bye. I forgot to end.